Hi guys, it's Taylor. So today my presentation is going to be on dependent personality disorder. This is just a presentation table of contents. First I'm going to be talking about the overview. Then I'm going to be talking about symptoms, lifestyle, therapy, medication, misconceptions, and I also have a works cited. Okay. What is DPD? So, dependent personality disorder, or DPD, is a disorder affecting a person's social and mental capabilities. It classifies as a social and mental illness. It causes immense anxiety in those who struggle with it. It's relatively the opposite of SCPD, or schizoid personality disorder. Patients with DPD cannot be left alone, while patients with SCPD prefer to be alone. Um, DPD makes time being left alone seem excruciatingly difficult. Patients feel desperate for another person's presence or attention. Patients will feel intensely fear disapproval, but they desperately also desire care and protection as well. People with DPD also struggle with decision making and tend to not be able to make decisions on their own. They'll need constant reassurance from others. People who are also addicted to drugs and alcohol have the higher chance of developing DPD. How does this happen? Dependent personality or disorder can stem from a variety of reasons. So, for instance, someone could develop DPD after experiencing a close to death encounter at a young age, especially. So, say like someone could have almost drowned when they were younger. This traumatizing experience could lead the brain to think you need to be with someone 24/7. That's where the need for care and protection comes into play. Also, growing up in a strict, authoritarian environment can cause a child to develop DPD. The fear of disappointment that children live in with authoritarian parents, it can develop an early sign of DPD. We learned in class about authoritarian parenting styles and what could come from that, and DPD is just one example. Um, Experiencing abandonment as a child, I feel like this is one of the major reasons why DPD can occur. As a child, you're already so helpless. So when you're abandoned, especially by like your parents, that feeling of never wanting someone to leave, is it's again, it's going to be reoccurring throughout your life. Separation anxiety as well stems from abandonment and can cause DPD. That separation anxiety will occur a little later in your life if you did experience abandonment as a child. Um, Drug and alcohol abuse, that already shows that you have addictive personality, so it's more than likely that you'd become addicted to people's presence around you, or just not wanting to be alone. Last is chronic illness. So say like you are disabled, or you just have an illness that requires you to depend on others. It's more than likely that you develop DPD just because you're constantly depending on others. Um, okay, so some symptoms of DPD are you have an increased difficulty being alone. You're unable to make decisions without reassurance from other people. We talked about the intense fear of abandonment and disappointment, especially how a child grows up. It's more than likely you'll develop that. You feel very, very hopeless and helpless. Um, you are the type of person to avoid conflict and disagreements. You don't want to, confront people. You're more like, I'll just stay back. You're more willing to tolerate abuse or mistreatment from other people. Um, these are the patients, that lack self-confidence, and it's more difficult for a patient with DPD to start something new. Jobs, especially, are very difficult for these patients to acquire. Um, you're overly sensitive to criticism. This is also because you lack self-esteem, so whatever harsh thing someone says to you, you're going to take it a million times worse than someone without DPD would. So the lifestyle of patients with DPD, it's definitely a struggle, like with any mental illness. We talked about tasks being very difficult for patients to perform alone. It could really be simple things like even making yourself breakfast in the morning. They can find that even doing that is difficult to do alone. There's been cases of people who even don't even like to shower alone. Um, those are just really extreme cases, like people just, they don't want to do things alone. People with DPD also hesitate on mostly everything that they do. They'll have second thoughts, and then they'll always want someone else's opinion just to clarify, like, if they want to make that decision or not. Um, People with DPD also deny their self-worth. They deny that they need respect from others, and that they just basically deny themselves as, people. And patients, they'll also feel deprived of their lives, which, if you think about it, it's kind of true. All of us, we make our own decisions without thinking really twice about it. But people who struggle with DPD, they can't do that. They always have that thing in the back of their head telling them, you know, it's a worry system. Like, what if they're wrong? What if, like, something else happens? They need that other person to tell them, yeah, you could do that, or no, don't do that. Um, if you have DPD, you tend to believe that your life isn't as important as other people's. You see yourself kind of as like a burden more of than just like a human being. People with DPD, like if they come across someone mean at their job, or, a jerk on the street, they're gonna put up with it. They're gonna put up with whatever someone's saying or doing to them to avoid the conflict, and they're not gonna put up a defense. Um, Patients are typically unable to see the bigger picture. Their vision is very closed off. They don't really it's really hard for them to understand that they aren't alone in this world, and that they can seek help and get the life that they need. And again, we talked about the intense feeling of hopelessness. It's a reoccurring thing for people with DPD. So, therapies and treatments for DPD. So, the primary treatment goal for someone with DPD is to increase their self-confidence and their independence. Um, they also want them to establish and maintain close, healthy relationships. Um, People with DPD tend to um, not be able to maintain healthy relationships. If someone's constantly depending on you, other people who don't have this illness or see it as an illness are gonna, get frustrated or not want to be around that person. So, uh, behavioral health therapy is often the primary method of treatment. It helps to strengthen a patient's brain to think and act on their own. Basically, it's a series of therapy sessions, like a talk therapy. Get a patient to talk about how they feel, and then for them to be able to hear from someone else, you're not alone. I feel like that really helps someone with this, but also they also talk about other things. Cognitive psychology is used. It's used to understand the emotions felt by somebody that struggles with DPD. It's also used to understand where it stemmed from. And psychotherapy is also used in more of extreme cases. It's a type of intense counseling. They're going to go more in depth and really try to extract these thoughts and these behaviors from patients. So some medications. Medications usually are not prescribed for patients with DPD. Not really many medications for DPD actually exist. Um, when medication is prescribed, it is because the patient also suffers from anxiety and or depression as well. So the medication will be used to treat that more so than the DPD. Some common misconceptions about DPD. First, it's more common in women. It's a mental illness. It can stem from a lot of things. Gender doesn't really have anything to do with it. You know, it's really about your upbringing and how you handle experiences and trauma in your life. So it's different from every person. In fact, DPD research has found it occurs equally amongst the two genders. So, another is that DPD only affects those in a romantic relationship. This is just false. We learned in the presentation childhood traumas are really what causes DPD, so it affects more than just those in a relationship. And we also learned that it actually can prevent someone from entering a romantic relationship or even like a friendship. It's just harder for them. Next is that DPD is the same as codependency. So DPD really affects just your everyday life. Every single day you wake up, you think about, what you're going to do, what's going to happen. And these people really do struggle with those thoughts. It seems like it comes so easy and like automatic to us, but someone who struggles with this illness, it just doesn't. And with codependency, you yourself take on the caretaker role, not need the care like you would if you have DPD. Next is DPD isn't treatable. So we learned that DPD is treatable with multiple therapies, obviously not medications, but with the different types of therapies and treatments that are out there, medication really isn't needed. And lastly, it's difficult to overcome. With resilience and the right support system, really anything is achievable. It's possible to overcome anything if you have the right backbone for you and the right system that's going to help you. So, and then this is my works cited.